Good afternoon, everyone. It's 101. Welcome. Thank you for coming. Please take a second to join the chat if you can, and name, organization, a key digital challenge for older adults that you have witnessed or dealt with or worked with. That would be kind of our teaser for the chat conversation today. We'll get started here in just a few seconds. Awesome. Okay. So, Julie, Sahai, Getachew, y'all ready?
Yes.
I'm going to just focus
Yeah, I'm
on my
ready.
slides. You guys can take over the chat and whatnot. How am I sounding? Good? Anyone?
You sound and look great.
Oh, thank you. Okay. All right, we'll get started since it's 3 minutes after 1 o'clock, and we're going to get rolling here. Welcome to webinar number 5 of the Maryland Digital Equity Coalition grant planning series. The idea bringing our digital inclusion ecosystem together and hear from partners and talk to people about current issues and how we can partner and how we can take advantage of upcoming opportunities to continue to grow and build our workforce and digital skills programming. So we've been focusing on different populations and different intersections of the digital inclusion ecosystem. And today we're going to discuss aging individuals. So my name is Terry Mumm. I am the Digital Navigator Program Manager for Marylanders Online, which is a program of the University of Maryland, Department of Agriculture and Natural Resources, Family and Consumer Science Extension Program. Is that the right tree? I think I got it. But if you're familiar with extension in land grant universities, it's our mission to leverage the university, the research, the brain power of the university to solve local problems on a global scale. So we work directly in the communities, which is how we ended up being the digital literacy team in that department, because that's a need that we see throughout our communities that we're trying to respond to and use the resources of the university to do so. So, as part of the university, our programs, activities, and facilities are all available to everyone without regard to race, color, sex, gender identity or expression, sexual orientation, marital status, age, national origin, political affiliation, physical or mental disability, religion, protected veteran status, genetic information, personal appearance, or any other legally protected class. Okay, so I'm going to jump back here for just a sec. So today, I just want to kind of frame our conversation. We're really hoping that this is an interactive afternoon and we can learn and kind of take, measure of where we are as it relates to older adults and digital literacy. We want to talk about how digital skills can transform aging services by increasing access to healthcare, economic opportunity, and social connection. As older adults continue to live longer, work longer, and take on caregiving roles, inclusive technology access becomes a public health and workforce imperative, not just a digital equity concern. Today, we hope to talk about how programs serve older adults and can integrate digital skills training into workforce readiness, lifelong learning, and health navigation efforts. The session will also provide strategies for positioning these efforts for sustainability through cross-sector partnerships and emerging funding streams. Some of those upcoming are the Maryland Digital Opportunity Grants or digital capacity grants out of the Office of Statewide Broadband, the Aging and Disability Resource Centers, and various telehealth funds. WIOA has the older work pathways. And then, of course, the number one thing we're focused on right now are building partnerships with libraries, extension, cooperative extension, local workforce boards, and any other direct service folks who are providing, wraparound services in any way, shape, or form. So we're hoping that we'll leave today with strategies that we all share together to integrate digital skills into programs for older adults, some insights into emerging models for AI literacy, telehealth support, and end of career workforce transitions, and opportunities to collaborate, of course, which we hope that we will do and continue to have these conversations in the future. So feel free to pop in and discuss. Today it's just me, so me and all of you. We are using these sessions as networking opportunities so that we can, get to know the landscape and the ecosystem and see where we can help each other out. Okay. Anybody want to jump in before I just do this quick little presentation? Great. Okay, let's see, where are we? So why does this matter? We wanted to kind of talk about some statistics that we can, use in our elevator pitches to talk about digital skill building programs for older adults. So whether it's returning to work or volunteering, managing chronic health conditions, or caring for others, older adults need digital tools more now than ever. But too often, workforce and aging programs operate in silos that ignore digital skills. We need an inclusive approach that meets people where they are at every age and every ability level. So you can see these stats, but nearly 1 in 5 are working or want to re-enter the workforce of folks over age 65. So we're looking at later retirement dates, later working times, and often later in life careers. We're seeing that a lot, especially in this area, with a lot of forced retirements and things like that are happening. Next slide, get it, you. So some of the barriers and gaps that we've witnessed in our conversations and heard. I just want to make a note too that I've been traveling the state for about 6 months now for various meetings and talking and meeting people in this ecosystem. So we are always constantly gathering and assessing the needs that are out there. So these are some of the things that we've seen and that the data reveal that for older folks, specifically the digital stigma and self-doubt, like confidence seems to be like the number one barrier to digital adoption for most older folks. Of course, then there's accessibility issues, font size, hearing, cognitive load, even when there are accessibility platforms or software, maybe people don't know how to use them or they need tech support for that. Or sometimes we'll see libraries pick them up and then maybe they're not ready when the folks come in and people don't know how to use that stuff. So there's a lot of gaps in our system that we can help. Same thing goes with fragmented services. We have a lot of really great programs out there. Really hard sometimes to connect to them and to connect other people to them. So, again, part of why we're here today is just to really discuss and share ideas and build more partnerships so we can kind of solve that issue. And then we see also that few workforce programs target older adults. So we looked at some programs here that across the state that we've been working through. Of course, Senior Planet and the Oats program. There's one in Montgomery County that's very popular. We've got a lot of kind of siloed, isolated programs in different counties and different places, depending on the space and the capacity of those organizations. Lots of activity in local libraries. Again, I think our challenge around that is being able to catalog those activities and connect people directly to the specific programs in the specific libraries and when they're happening and how folks can access those. Um, our program is awesome. We're here. Our goal is to support folks doing this work. So, any kind of tools, curricula, training, all of that stuff, we are here and established and available statewide to be a resource for any partner that wants to work on digital access for older folks. And then there's the AOA funded aging and tech pilots. We don't know necessarily what's going to happen with the federal models, but we hope that they come out in one form or another, and that maybe we can pivot to whatever may or may not be replaced in the future if we stay connected and informed of those changes. So what can we do next? The resounding theme here is to coordinate across workforce aging and digital equity touch points, which we know is, we intersect with digital inclusion at every point of the social determinants of health. So there are wraparound services and different places where we can support people to make a stronger connection online and to be able to use these tools. We also want to make sure that we're leveraging funding by having conversations like this and sharing applications and building partnership projects. We mentioned those earlier. I did drop a PDF in the chat that has some links to these very typical these are the base level opportunities that are here right now. Again, not sure about the federal opportunities, but we're going to continue to monitor those and continue to have conversations when opportunities arise. And then I would just like to invite you all to, work with us and join MDEC and continue to show up and share information about your programs and your partnerships and how we can help each other. Okay, so we're going to go to the discussion part of this conversation. I really hope folks can come off mute, share information that they may have, ideas if you have an event coming up, if you're, we'll start with some of these questions, but really it's a pretty free-flowing conversation. But we'll start with what health technology or telehealth access challenges do you see among older adults, maybe that we haven't talked about here today? I'm going to have to do my bad joke about I can do really long silences for long, uncomfortable pauses. So somebody's going to have to break it.
Hi, Terry.
Hey, who's this?
Angela. To answer your question on access and challenges that we see amongst the older adults, and we have media to also thank for this, but all the fears that they hear, that particular group is very fearful. And they were the groups that grew up with manual, and technology just blows them out of the water. What we see here is they won't come in. They'll come in, but they don't want to do it. They want us to do it for them. They don't want to have to face what they would consider shame. It's not shame for us because we're here to help, but that plays a big role in them wanting to learn something that is totally out of the blue for them. They don't know how it's going to respond, and every day they're hearing something negative about it. That puts the fear of God in them, and they don't want to play. We just had a privacy booth put in at our library that they can access telehealth. Because in the area where we live, we're 50 miles in one direction from special medical needs and so forth, and another 25 in the other direction. So we don't really have a place where we can go here. There's practitioners here, but it's mostly workers' comp stuff. But to get access, if you're new in the community, they're not accepting new patients. Or if you're established in the community, it takes a month of Sundays to get in to see your physician. So through the telehealth booth, it gives us the ability to take them in a privacy area where they don't feel like they have people staring at them because they don't know how to operate a left click from a right click, or they don't truly have the devices at home because they can't afford them. It's either buy my medication or have a device that I don't really know how to work, and I don't want complications. I just want the simple stuff. So we have that ability to take them in and provide that privacy for them and invite them back for other things. We've got keyboards that have the large type keys on them. We have a reader that magnifies. If they want to sit in a library and read, it's a magnifier, so we provide for that. We also have we have two rooms, one down the hallway, and then the other one that is in the booth itself. But we're capable of connecting them with their doctors or healthcare providers to get their medicine called in. That's one of the biggest things that they have the need for. So we're trying to provide that along with sometimes just having them come in and have a social hour just to talk about the fears they have and then correct those through just coffee and conversations to help them get over that hill.
Absolutely. The user safety is, it's a very valid fear. So it's hard, when we can visualize the safety measures or the workarounds, right? But we get asked almost on a daily basis at this point to provide, internet safety presentations for people and how to make safe decisions online and access things. So I feel for you. I wanted to ask you one question though, Angela. Like, so when people are making those appointments, those telehealth appointments, is it your staff that's helping them do that? Or they just kind of show up before the appointment and then
They
is it
show
also your staff trying to help them connect?
Yes, my staff is trained to help them connect.
Nice.
They had to go in and get certified, so they are aware of what telehealth is all about, so they
Mhm.
can further help them. The one thing I do have them fill out is a form, and that informs them that because of the HIPAA laws, the staff is not medical,
Mhm.
so that they know we can't give them medical advice. But we walk them through everything, and we help. Mm, we don't really have to translate anything because the cameras are there for them to see their healthcare provider. But just giving them that space, and if they still need help, on the computer itself in that room, we have Medline Plus that we can guide them, point them to understand their prescription medications and side effects and all of that stuff. We have, they can watch operations taking place if they're gonna go and have a certain surgery done. That kind of,
Yeah. Yeah, that's great. That reminds me, I'm going to go to Bori's question here, about the NRTCs, right? Do you work with them, the Telehealth Resource Center and the trainings? I know
yes.
yeah, that's a really good resource for people. We should put that on our list. They have all kinds of telehealth training for different telehealth, digital services such as this. So, Bori.
Um, I guess I can speak from sort of my personal experiences with like assisting my parents because they're in that generation where everything before, was paper, fill it out by hand, and going physically in for appointments. I think the challenge that I see is the amount of passwords they're asked to remember. Um, and going back to what Angela said, like they're more comfortable saying, "Well, can you do it for me?" Because what I've noticed is when you do it for them, they don't have that practice or that muscle memory. So when they do forget, the first trigger they'll say, "Oh, like, well, you did it for me," you know. So I think for for anyone that's like assisting someone in that particular area, I think it has to be either like a shoulder to shoulder if you're in person, um, and not holding their hand and just have them do it, so they can develop that muscle memory, and then encourage them, saying, "Hey, the more you do this, the more you're gonna be able to not be overwhelmed in doing it." And also, I think people are more familiar with like these platforms like Zoom, and Google Meet, and then all of a sudden they have another portal they have to worry about that does their own video conferencing. It can get overwhelming for them. Um, but that's what I've seen. The challenge is like Angela said, they're more comfortable having someone else do it for them versus them taking, I guess, initiative and action. But also, I think, like I said before, that has to come from us, whoever's helping them, and giving them that encouragement as well, because the encouragement goes a long way, because then that kind of eases that self-doubt, that shame that they don't want to experience.
Very well said. That's absolutely true. I mean, we notice that when we go to events that people come and, as soon as they have a conversation, then they start asking the questions about their technology or, but just to kind of walk up and be like, hey, how do you feel about, technology or, do you want to use this computer for this thing? And like that doesn't seem to be the thing. It's the confidence. That we need to build, and that's going to come from our local community connections, and that's why we want to continue to help coordinate and get together on these programs so that we can share training and resources to be able to provide those services, because the point is that it's pretty, maybe Angela you'd agree, but it's pretty intensive stuff. It's not as simple as just, hey, we're going to help this person with this telehealth appointment. Um, it's long and time consuming, and has a certain level of technology, know it all to do do this stuff.
Not to mention, now you have to have a third party to verify who you are when you're trying to access your device. That just adds another element of, oh, it's too much. I just don't want to deal with it. The patience isn't there because of the fear.
Yeah. So that kind of leads me to our next question. Have anyone here integrated digital skills training into health-related programming? I mean, we just heard about the library and the telehealth appointments, but specifically, folks working with aging populations, what specific digital skills training have you sought or used or would like to use?
Hi, Terry. I'm Chris Stark with the actually University of Wisconsin Extension. I thought I'd like to see what you guys in Maryland are up to because I think you're the leaders in the country on that. But I'll turn the question around just a little bit. I don't actually teach directly. I'm not a digital navigator directly, but what I'm hearing and what our broadband team has learned over the past couple of years, and almost turning the question around a little bit, is from the health entities, such as covering Wisconsin, which was Wisconsin specific, but their health navigators, where they went out to point at, to people's homes and et cetera, to point out to the best health options for them. In most cases, folks beneath a certain income level, but at the same time, they were required. It was necessary for them to provide digital skills training to the people. So while the people were getting their health navigators, they were getting a digital skills lesson, and now they just call them, at least covering Wisconsin, calls them digital health navigators. That's what because it was so prevalent. At the same time, I think you have the ADRC, if I'm not aging and disability resource, however it is, resource centers, and then each county has, and in Maryland as well, the health departments. They too are finding the same things, that they've had to be digitally, at least have some degree of digital fluency, if you will, for lack of a better term, I guess, to show people their options and their choices. And so this has really been, especially for seniors or 60 and over, this has been a particularly important educational tool for them. So.
Well, yes. So we are actually, I think I could almost be classified as stalking community health workers at this point, to try to make that a stronger connection between those community health workers and digital skills training. We're working at building, those relationships and providing digital navigation training of trainers. Classes and certifications and also resources and tools that they can use in their job. So that's a great, connection there. And it is definitely the direction that we want to go as we're moving forward, but not just community health workers, but that's a perfect example of where this work intersects and how, a community health worker doesn't necessarily have the tools and resources to identify every single safe source of health information or, how to use all the different tools online. So, yeah, that's great. That's definitely right on track with what we're hoping to build with this ecosystem and the folks that are here. How about anyone else with integrated digital skills training in their program, in their health programs?
Hi, my name is Casey. I'm from Massachusetts, and I work with I have a program for digital navigation in healthcare systems, and so I work with not all, but the federally qualified health centers throughout Massachusetts, so the entire Commonwealth. And so each of the health centers is building a navigation program, and they have different goals depending on where we saw gaps in care. And I feel like it's definitely a powerful movement right now, and I'm just here to listen and learn more. But I think for us, it's definitely been really successful. One things that all the health centers do is they enroll patients in affordable internet if they need that service, and then they go over all of the skills, and then they help enroll in either telehealth. They practice video telehealth. They work on RPM, things like that. So it is exciting, and we have a lot of momentum moving forward right now.
I love hearing about everything that's going on. Anybody else with some examples of digital skills training in their programs you want to share? I'm like perusing the audience, like who's here? Okay, let's move on to workforce related goals for older clients. I would love to hear directly from you folks on what you're seeing in terms of workforce and career pathways for older individuals. Germania?
Hi, it's Hermania.
Oh, sorry.
I'm in Chicago, and we have a digital literacy sort of open lab once a week. We have them at different locations, but I'm at the office in Pilsen, and what I'm seeing is older folks looking for work. So they don't know how to upload their resume. Um, you know, to try to get employment. So that's like a big and common thing. And sometimes not even so much as older as you would think, but maybe their last job, they got it with a, paper application. And now times have changed dramatically and they're out of work and they don't know how to go about it, the whole job search process. So, yeah.
Hi there. This is Ann Banks with the Center for Digital Equity. And I love what you were mentioning, Jimena, because what we're seeing, at least in North Carolina with some of our aging adults, is the economy, a lot of folks trying to get back into work. And there is a program, at least here on the coastal part of North Carolina. It's through United Way and it's called the CSEP program. I don't know how many of you are familiar with it or have it in your states. I'm pretty sure it's a national program, and it is the Senior Community something, CSEP, SCSEP, Senior Community Employment Program. And what they do is they provide the training and basically they give seniors a job for up to 20 hours a week. And it's been very successful. I spoke with a lady yesterday at a senior center who was employed by them, and she said it changed her life. She was going into a deep depression. She was getting behind on her bills because she was unemployed. And that little bit of training and that job security was what she needed to do to go on and kind of pull herself out of some of the health problems that she had. Oh, yes. Thank you, John. Yes, CSEP. I highly recommend it for anyone who hasn't interacted with that program. It's a wonderful resource.
That's amazing. We'll add that to our list. Fantastic. I was going to say too, I came from Utah. I was this digital access program manager for the state of Utah, and I worked a lot on the Navajo Nation. And one thing I noticed there that really stuck out was when folks wanted to return maybe back to the reservation or to their properties to care for their aging parents, that there was nothing there for them, right? They didn't have the connectivity to work online, to take classes, to do anything. So we're seeing that a lot there. And I've heard that a little bit here, that people want to maybe go care for their family, go back to their rural, home or wherever, and just not have the infrastructure or the access to get any kind of meaningful online work or take online classes and things of that nature. Okay, we're going to move on to the next question. What workforce related goals are your older clients aiming for? Is it just to get a job? Is it, is there an interest in the tech world? Like what does that future kind of look like for this population? kind of a tough one.
I think it depends on the individual and how bleak their mindset is. But uh, because that particular group, as far as I'm concerned, what I see here, that particular group, with the economy the way it is, they have to go back out into the workforce and work. And as far as there's a lot of them that want to learn technology, just the basics, just to get through, to get a job, to support the part that Medicare isn't covering, with their medicines, or to have a little quality of life when it comes to just having, I just say everything from snacks around the house to having that ability to socialize, that social well-being atmosphere needs, they have that strong need for that. So the ones that do come in and want the training, that's the key. They have to want it so they can learn it and continue to absorb. But for the bigger part that comes in and doesn't want to take in all that because it's noise to them, they just want to get something done and get out because they have their little routine set. So when you start going down that road of, hey, you need to do this, step 1, step 2, step 3, you can print out all the handouts you want and give to them to guide them. But some of them will use the excuse, I don't remember. But for the most part, I think they want to know, to keep up with their friends that are in the know, to have that social connectivity. I think that plays a major role. And for a lot of them, that have the devices, the phone itself, it becomes their television because they can get Tubi or things like that because they can't afford cable.
Yeah.
I remember they were asked when broadband first put down, we're looking at coming out here and laying those fiber optics down. They provided computer classes and stuff like that. And it was Broadband Technologies and the American Recovery and Reinvestment Act that pooled money together to pay for all of that. And even after that particular training, it became all about the money. Could they afford? What could they afford? And then public libraries turned in that direction of, we're going to provide you this training for free. Just come on in. We want you to come in. But again, as life progressed, society progressed, things got scarier and scarier for them. And now it's, I mean, even with ebooks and audiobooks, just to get through Libby, they have to know how to navigate. And that's a struggle for some of them. So they stick to the physical books rather than choose technology because it's easier.
Yeah. Yeah, the infrastructure definitely needs to come with, support and tech support and skills support and stuff. So thank you for everything that you do. It sounds like an amazing program for sure. So that's a great segue for our last question. Just talking about what does a supportive, age-inclusive digital training model look like? Like what do you see that's working? What do you see that you would like to see? Like what's your, pie in the sky support training model? What does that look like for you guys?
Harry, if I may, I just want to highlight this really great comment that could really segue into this question from Dr. Doris Carver in North Carolina. Um, they said last week, I would have said that accesses to devices and internet connectivity would be an important barrier, but now I think that the communication barrier is much more significant. The lack of effective communication to people throughout our nation is the gap. By that, I mean that we need to do a much better job of letting people know what is available, where to find resources, and develop a national centralized clearinghouse / single point of information for dispensing reliable information.
Yeah. As our information gets less reliable, right? Like, yeah, absolutely.
Right? Like who would be the entity that could funnel that information through that vets, from a larger scale challenge there.
Well, I mean, that's the rub, right? Like, is it the national level and or do what I've learned in the last couple of years is just the community level, the local level is where the trusted relationships are. And that's where, we need to, I don't want to say empower, I want to say, we want to like inform or provide resources, and equip people to be able to do that work. That's our goal here at Marylanders Online. And unfortunately, like information is one of those things that is just it's not so easy to tell anymore what are quality sources of information. And so um we've lost even more public trust.
And this is Doris Carver. So let me tell you where I'm coming from. We had a digital opportunity conference last week, and then I managed a digital navigator project for 20 community colleges in North Carolina. We have 58 community colleges. So our digital navigator project, we rolled out with 20 pilot colleges. Our task was to put a digital navigator, have them trained in put at 20 community colleges, plus develop a online training program for them that they all had to go through, and that went extremely well. We've served over 7,000 people so far during this grant cycle. And we have monthly meetings with 10 of the cohorts in the East and 10 in the West, but we also implemented one-on-one meetings with each of the pilots. And what has emerged as a trend is that while they're doing a great job of going out in the community to tell the people what's available, the citizens still don't know. So I think we lack a branding so that we can all get on the same page. If they see it in, Durham, or if they see it in Raleigh or Charlotte or Baltimore, wherever, people recognize what the brand is and they recognize where to get help. I can tell you in North Carolina, they can call 211 and get digital navigator help. They can call 20 of these community colleges and get digital navigator help. The public library system does the same thing, but we're all doing our little silo, but we all need to, my opinion, we all need to develop a brand, something that is recognizable across the nation or even statewide would be fine too. But if you're in Maryland, you got folks in DC or you got folks in Virginia that cross the state line or the district line, and it's just come to a realization to me that we're still missing the mark communicating this out to people, whether they're a 20-year-old college student or they're a 70-year-old senior trying to connect with their grandchild. We're still missing the mark.
I agree. Like 211 is pretty branded, right? And
But see, I'm on the board for the North Carolina Retired Government Employees Association. And so I go to my district meetings. None of them knew about
yeah.
211. None of them.
Yes, you're right. Oh man, that's a really good point. And we all are working, I think, in our local communities, or at least state by state, to try to create, some kind of resource guide. And we're doing that too, asset mapping for Maryland, and trying to help get the word out. But it is, I just, it's a constant reminder of folks that we're here. Speaking of that, Getachew, can I have my next slide if he's still around? Let's see. Did we go? Well, so there's these. We definitely have our upcoming webinars and digital opportunity grant basics. I'm going to let Julie give you the rundown of all things coming up, Maryland. But I do want to go to the next slide. There we go. Which is just the information about Marylanders Online and our helpline. So folks are free to call that for our call center, which is open Monday through Friday from 10 to 8. And we have awesome digital navigators ready to go. We also have our new Monet Marylanders Online Navigation Education Toolkit. And we're getting ready to run our first training cohort for that. And we're really excited about that and hoping it's something that we can continue to share across the country. We've had some requests from other states, and happy to work with folks on providing those resources for navigators moving forward. We have lots of other things happening as well, Julie.
We do. Sorry, I am flooding the chat right now with some resources for you, and don't feel like you need to download all these. I will follow up with a follow-up email with all of these this information. But one thing to note is we actually just added 2 more events for this series, the Digital Equity Grant series, and those are going to be in June 4th and on June 5th. So definitely feel free to check those out. We also have a health and tech webinar series coming up starting May 16th all the way to June 27th. We had a very successful 2025 Empowering Health webinar conference last Friday, and we had over 220 people register, and we want to continue that conversation, really diving into, the convergence of health equity and digital equity, and really diving a little bit deeper into the conversations around emerging health technologies, AI, and how that is going to look in the future. And then finally, we also have another, one more, the anti-scam webinar that's coming up on May 13th. That's next Tuesday in the morning. We are going to be recording all of these, and we will add them to our YouTube channel. So if you haven't already, please make sure you follow us and subscribe so you can be updated. We also have this recorded, but again, I will follow up with all of this information and more. And one final request as we kind of start closing out, I was hoping you would all be kind enough just to take the time and complete our survey. This really does help us better understand what it is our communities, both in Maryland and beyond, because we have so many great other states here today. We love hearing what you're doing. We love sharing what we're doing. Please take this brief and anonymous survey to tell us how we're doing and help us continuously improve our services. And I will drop the link there in the chat. Yeah, I think I'll get off my soapbox now.
Amazing. Okay, let's see. I'm going to let's see if I can pull this up. Gotta choose the screen share, I believe. I was gonna maybe pull up that poster, the new flyer, right?
For Monet?
For just the remaining 3 webinars in the series.
Oh, yes. I just dropped it in the chat.
Oh, perfect. If I do it off my head, it'll be I know we have folks accessibility focused one coming up next week, I believe. We're doing an AI focused one on May 28th. Telehealth on June 4th, and evaluation and shared metrics on June 5th. So that's it for us. Any other additions before we let you guys take off today, or any? I'm happy to stay and have this conversation for as long as we want to have it. I just wanted to make sure we got our our housekeeping done there. Yeah, so folks with disabilities and digital inclusion is Wednesday, May 21st. AI and digital skill building will be May 28th. Technology for health outcomes and telehealth, June 4th, and program evaluation and shared metrics on Thursday, June 7th. We'd love it if you would join us. And if you're not a member of the Maryland Digital Equity Coalition, Sahai put that in the chat. You're welcome to join us, and we'll continue to share everything that we gather and all of our upcoming educational opportunities and ecosystem work. Anything, please join us. Thanks for joining us today.
Amina, you can click the link that Sahai just shared in the chat, and you will be enrolled in our distribution list and be the first to know. Oh, well. Thanks for being here today.
Hi. I have a
Hi.
quick question. I had a little emergency in the center and couldn't jump on earlier. Is this being recorded?
It is.
Okay. And
Yeah.
just access it on the website or?
Yep. And on our YouTube channel, I think Julie's been putting the links up. So
Okay, great. And then the other thing is, if you applied last year and you didn't get it, is there any kind of a scoring system that you can learn from that we could that you do on people who have applied for the grant in the past but haven't gotten it?
we're not we don't have a grant opportunity open.
Okay.
But we are, so that's what we're trying to do is like help people partner and build those projects. Some of the opportunities we're looking at right now for digital inclusion specifically are new funding sources that came out down through the Digital Equity Act and the infrastructure bill.
Okay.
So I doubt that they would have that kind of information.
Right.
But that's a good question. I can ask our statewide office of broadband too, because they've had some other grant programs, computer lab programs and different capacity building programs that maybe they do provide that kind of feedback. I'm not sure. It really usually depends on the funder.
Okay, because we did apply for the digital equity grant for older adults last year.
Oh, okay.
So,
Okay.
and the year before. And I was just thinking, is there anything we can do to learn how to improve our chances going forward?
Sure. Yeah. So I would come to the evaluation workshop that we're doing on June 5th. Because
Okay.
we are working closely with this Office of Statewide Broadband, and we've aligned our evaluation metrics to align with those funding sources. So um, that's the biggest, I think, thing right now is being able to show your outcomes, right? For your programs in terms of funding and points on grants and things. So, we're trying to help it so our ecosystem can have more shared metrics and be able to tell that story a little bit better.
Right.
But yeah, that's great feedback. And they keep that pretty tight from us. Like we don't know who applied or who not, which is why we want to have these
Okay.
conversations so that we can continue to help each other,
Yeah.
build better projects that
Yeah,
we
I just recently, it was another grant. It was for like a security, like hate crimes, and I had applied last year, and then that was the first time I've actually gotten the scoring was shared for me, and I'm like, oh, that would be cool. So, because I've learned
Yeah.
so much, like they shared all the scoring, more information here, and we need to know this here. So That would
It's
be
great when you get a good reviewer that gives you those notes. Yeah,
Right,
it's
right,
very
yeah.
helpful. And,
So,
you know, we're open to partnerships too at the university around, you know, reviewing applications and stuff like that too. You know, if folks need help with that, we don't really do grant writing services, but as a partner, you know, we can kind of help
right.
folks, you know, kind of tell that story, you know. That's assuming we get funded, right?
Right.
So awesome. Well, thanks for
All
your
right.
questions.
Thank you.
Okay, I think we're good to go, huh?
Yeah, thank you.
Terry, thank you, Terry.
Thank you. Thanks for your help.
Okay, do you
Bye.